Good morning, everyone. Today we'll be talking on the topic isolation in pedodontics. The contents will include isolation and its importance, the methods of moisture control, equipments needed for isolation, dental materials performance and stability under isolation, previous ways of isolation, the newer techniques, rubber dam, recent modifications, indirect methods, conclusion, and references. So, what is the importance of isolation? Complexities of oral environment presents obstacles to the operating procedure, starting from diagnosis till the final treatment is over. In pediatric dentistry, challenges for access to visualize and manipulate instruments are more, as the oral cavity is a difficult area to treat because of the constraints of lips, tongue, cheek, which is improperly managed, as well as bleeding. Also, in pediatric dentistry, the child is sometimes a difficult task to handle, and to add on, saliva becomes a dreadful situation. Pediatric patients are also more prone for accidental swallowing and aspiration of instruments when they are uncooperative. Thus, isolation of dental working field is one of the most important and yet sometimes most underappreciated aspects of pediatric dentistry. Separation of a tooth or a group of tooth from oral tissues and saliva by use of a dental dam, cotton rolls, or other means to improve access, visibility, and control moisture contamination while restoration or operative dental procedures are performed. So, what are the goals of isolation? We need to have moisture control, we need retraction and access. There should not be any kind of harm. It should be safe, aseptic, and to prevent accidental swallowing of any restorative material. So, as I said, this is a flowchart of the goals of isolation. Coming to the methods of moisture control, we have direct methods, pharmacological methods, and methods used for gingival tissue management. Under direct methods, you have the rubber dam, absorbent materials, that is cotton rolls and cellulose wafers, low volume evacuators, high volume evacuators, air water syringe, throat shields, cheek retractors, and mouth props. The pharmacological methods includes anti-sialogogues, anti-anxiety drugs, muscle relaxants. The various methods used for gingival tissue management includes physiomechanical, chemical, chemomechanical, rotary curettage, electrochemical, and surgical methods. So, what are the equipments needed for isolation? Under tissue retractors and protective devices, we have the rubber dam, cheek and lip retractor, tongue depressor, and metallic bands. Saliva ejectors and high volume ejector evacuators are categorized under the equipment that is used for evacuating fluids from the oral cavity, whereas absorbent paper pads, wafers, cotton rolls, and gauze pieces categorized under fluid absorbing materials. The previous basis of isolation was basically by means of absorbent system, oral evacuation system, and cheek retractor system. Indirect method involves comfortable position of the patient and relaxed surroundings, local anesthesia, and drugs such as anti-sialogogues, anti-anxiety drugs, as I've mentioned before. Coming to cotton rolls and cotton roll holders, this acts as an aid in absorbing moisture and helps in retracting the soft tissues. The use of saliva ejectors and cellulose wafer along with cotton rolls will further control salivary flow. You can see the picture of the cotton retracting soft materials. Now, how it is fabricated? We have manually rolled cotton absorbers or prefabricated ones that is more compact and absorbs greater amount of moisture, which is available in sizes of 2 and 3, that is small and medium size. Cotton holders can also be used to secure cotton rolls in their respective positions. You can see here the metallic devices which are positioned in the oral cavity after placement of the cotton rolls into them. So how do you place the cotton rolls? If you are working on the maxillary segment, for example, the maxillary right segment, you need to isolate the maxillary right buccal region. Okay, and if it is a maxillary left, you isolate the maxillary left adjacent vestibule. If the procedure is being done in the lower quadrant, you need to isolate the upper buccal, upper lingual, as well as the upper buccal. The other isolation techniques include throat shields, a gauze sponge that is unfolded, spread over the tongue and posterior part of the mouth. This is usually used to prevent accidental aspirations of smaller instruments. We have saliva ejectors, or what we call as the suction tips. It is a small straw-like oral evacuation system, which can be of stainless steel or plastic. The function of this is it helps to keep a dry feel for sharp procedures. It helps control saliva and moisture accumulation under the dental dam. It also helps to keep the patient from swallowing accumulated water. High volume evacuators, as we know, they are made up of disposable plastic or autoclavable metallic tips, beveled, placed as near as food being prepared. They remove collected moisture and debris from the mouth. Washed operating field improves access and visibility. Then we have low volume evacuators, that is saliva ejectors used along with cotton, rolls, rubber dam, and cheek retractors. A cheek retractor is an indispensable part of the armamentarium, which is simple, inexpensive, and disposable as well. It helps in accurate impressions and retracts the lips and the cheeks for digital photographies for a better access and visibility. It is used to expand the mouth opening more in the vertical rather than the horizontal direction, which is available in 3 sizes, small, medium, and large, which is color-coded. Again, we have the lip retractor, which is a simple, small device which helps in retracting the lips. There is a device called a Sphincter, which is a metallic saliva ejector with a tongue retractor used for mandibular arch, and it is most effective when the patient is in a nearly upright position. Again, mouth props can be used, which is a relief of responsibility of maintaining adequate mouth opening. It helps in relief of muscle fatigue and muscle pain for the dentist. It ensures constant and adequate mouth opening. Newer techniques. Under newer techniques, we have swift leg saliva ejector, which is an efficient, flexible curve and comfortable, and it reduces aerosols during treatment with superior suction capability. Thank you.